Let's uncover the journey of Nigerian healthcare professionals making a difference in Nova Scotia. Meet Nigerian healthcare professionals, who left everything behind in Nigeria to bring their medical expertise to our Nova Scotian shores. They faced harsh winters and homesickness, but their dedication to patient care never wavered. They moved here with dreams and determination. They are now a vital part of our community. Their journeys weren't easy: cultural adjustments, family separations, and the challenge of getting credentials recognized. These are just a few hurdles they overcame. But through it all, their resilience shines. They've become pillars of our healthcare system, blending Nigerian warmth with Nova Scotian kindness. Let's celebrate their stories and appreciate the rich tapestry they add to our community. Stay tuned for more incredible tales on Voices of Nova Scotia.
Hello, welcome to today's podcast episode of the Voices of Nova Scotia, where we showcase the journeys and experiences of our healthcare professionals. I want to start by asking you, could you please introduce yourself?
Okay, I'm Dr. Ajayi Israel. Babatunde. I am from Ekiti State, Nigeria. I grew up in Lagos, went to school in Lagos, primary, secondary, university, trained in Lagos, and practiced for a few years, or probably many years, I would say, because I practiced many years and left Nigeria 2017 to move to Canada with my family. In the mix, just after medical school, a few years or a couple years after, married my wife, and we have 3 kids. And here we are in Canada, finally moved to Nova Scotia, practicing medicine, general practice in Tattamagush, Nova Scotia.
We know how demanding this career could be. So can you please tell us what inspired you to pursue a career in healthcare?
It's a complex, it's kind of like a complex question, talking about the motivation for practicing medicine, but I would say that it's something that I've always thought about, like being a child. I found myself thinking about wanting to be a doctor for some reason, probably because we had some doctors that lived in our compound as well. And secondary school, if you're one of those very good and bright students in, I believe probably your junior secondary school, you end up probably thinking about going to science class, ended up in science class, and really the only thing I really wanted to do was medicine. And I believe maybe there was some encouragement also from parents, given the fact that one of my parents also believed that she's convinced that I was going to become a medical doctor. But all together, we're here.
What motivated you to move to Nova Scotia?
As an immigrant, you obviously, one of the struggle is to try to get into your medical practice. I believe I was living in Ontario before moving here, did all the necessary exams, and applied to Nova Scotia. And I would say that everything went pretty good. The application went straight and successful. And I'm here, been practicing for some years now, and found Nova Scotia really good. I wasn't particularly targeting Nova Scotia, but it feels like home now.
Can you tell us what your experience has been so far working in the healthcare system in Nova Scotia? What has been the highlights, and what has been the most outstanding experiences in your journey so far?
Yeah, NS Health system overall, I would say, is good. There's a lot of different experiences. The NS Health workers have a goal, and the goal is to make sure that the public demand is met. Basically, we need healthcare workers. For example, we need doctors, we need nurses, and I think they're working hard at trying to make sure that those gaps are filled in their best. They're working that out in their best capacity, I believe, and that's what I've seen them do, over the years, trying to fill those gaps, and overall the staff generally at NS Health are friendly, and appears that they want to genuinely help you and sort out any issues that you may have to the best of their capability.
Is there anything you like about the healthcare system in Nova Scotia? Can you share some of those, or if there's any, can you just share some of those experiences with us?
Like I said earlier, I used to live in Ontario before I moved to Nova Scotia. I remember the first time I got to Nova Scotia, driving out of the airport, and I looked up in the sky, and it looked like super different than Ontario, and I felt, this is like clean air, and so literally that's exactly what it looked like to me, just driving outside the YHC airport. And obviously we went for site visits, and we had boat cruise, boat rides, we visited different places, and everywhere looked pretty much the same. Nice, friendly, beautiful, not super densely populated where I was coming from. I'd say all of those things made me feel like Nova Scotia was going to be home, and having lived here for over 5 years now, I can only agree more with my first impression, because each time I visit places like Toronto, I just want to come back home. The healthcare system in Nova Scotia, I would say, just like any all around the world, is striving for improvement. However, overall, we take and consider the public, the patients first. So everything we do as Nova Scotia Health is pretty much striving to meet the public demand and make sure that everybody is connected to a doctor. Personally speaking, obviously there are some good and some not too good experiences. Just like all over the world, you would have people who may not necessarily like you for certain reasons. However, because of the processes that are put in place in the NS Health system, you're able to overcome challenges. So it's important that we get to know other colleagues, and if we're going through any struggles, to discuss about them, so that we familiarize ourselves with all the available systems that helps us go through struggles better. So far my experiences are very good overall, and the struggles that I've gone through, I've been able to, through the system process that I've followed, things have been really good. So overall, the NS Health system is really working to make sure that our experiences are very good, and most doctors, I can't speak for most doctors, but I believe that, I am enjoying the system.
So what challenges did you experience when you moved to Nova Scotia, and what has been your challenge so far within the practice in the province of Nova Scotia as a healthcare professional?
So just like every other immigrant, if you move to a different place, you're certainly going to face some challenges, and I don't think that they're peculiar to Nova Scotia alone. You're coming to a new place. We need housing. For someone like me who's a family man, we need other things that for the kids. We want our kids to integrate well. We want our spouses to integrate well. And these are one of the challenges. Trying to get daycare for kids, trying to find a place to stay. Luckily, Nova Scotia health worker was able to help with finding a place, but unfortunately not with helping with kids. I know that in the mix of COVID, we had a new baby, and that was even particularly challenging, but there was pretty much really no support. I do know that one thing one of my nurses say at work is if we could actually have daycare attached to clinics and hospitals, that maybe a lot of nurses will be staying at work, and so that's just one of the proposed solution. But I believe that those are the challenges of like moving here. Also finding the community. That wasn't really hard. Like finding a Black community, Nigerian community wasn't so hard. I believe COVID added a lot to the problem, in my own opinion, because we moved here during COVID, and so it was really hard to like even meet anybody. It was just like you were on your own. So I don't know if my answer to this question is clouded by the COVID pandemic, but I think generally just general immigrant struggles.
So how has the Nigerian community supported you in your career journey, and in what ways have you received any form of support?
Like I was saying, not everybody moved here during COVID. I did. So moving like exactly when COVID restrictions started meant that there was no community experience. So it's quite tough for me to say exactly how the Nigerian community has helped. But over the years, I met up with different people in the Nigerian community. I met with colleagues, Nigerian colleagues. There's also the church community, where we're able to meet a lot more people. We would come to Halifax for ANS programs, and I've also met a couple people through ANS, and we had a program recently here in Truro. So I believe that the community is getting stronger, and I think that as we get stronger, the experience can only get better.
Can you tell us what, in your opinion, you feel or think that the government of Nova Scotia can do to attract more talents and retain more professionals within the industry? Are there any ideas from your experiences that you can share that can help the government retain most of the talents that are, or attract talents who are trying to get into the system of healthcare?
I think the government of Nova Scotia is trying to make sure that they feel the demands and meet the public need for healthcare workers. But obviously, we can always do better. want to first applaud them for like the programs that they're doing, trying to make sure that they create more routes for doctors to be able to come in, because obviously we have so many doctors in Canada that are doing a lot of other things who can actually be doctors and provide standard care to our patients. While I applaud them, I think that it would be reasonable that they work with immigrant doctors so that we can liaise and also see how we can make sure that the gaps are further closed. So, working with immigrant doctors, I think is going to help shed more light into how we can attract more doctors. And the way we can actually make them stay is, when you attract someone, you want to make sure that their lives are not necessarily easy, because, that could be multifaceted. However, not making their lives more difficult. That includes, helping with housing, spousal, also, engaging their spouses, making sure their children get schools, and that they don't have to think about those very basic problems, and also making their jobs in terms of remuneration also competitive, but I believe that overall making their new place a home to them will actually make them stay beyond even the remuneration.
How has working and living in Nova Scotia changed your perspective and your expectations about the healthcare system in general?
Like I said, Nova Scotia is a really wonderful place. I mean, if you're not the type who likes to live in London, England, or Toronto, in a very densely populated area, you would find that this is a very fine balance of like rural and urban living. To me, Nova Scotia has confirmed like the kind of like lifestyle that I really, want. Like nothing too big, like something more calm, stable. Like you wanna move from here to there, and there's literally no traffic. I mean, I can't speak for people living in Halifax, so there's really no traffic. You can get wherever you want to. You can have family activities. You can quickly go to the beach. You basically, I mean, besides COVID, because we keep talking about COVID, we have friends, we have families, like everybody can like easily get together. I mean, Nova Scotia is that province where you have your life like on cruise control, and you're just going, and you can just build and overall enjoy life. I can't speak for people in densely populated area. Thank you.
Thank you very much for sharing your story, your journey, and experiences with us today. We really enjoyed hearing from you, and we enjoyed really taking us through all the experiences that you've shared. Thank you so much for the ideas that you have given us on how to grow and retain talents. And to you who's watching on the show, thank you so much for your time. We hope that this show has inspired you today, and we look forward to having you on our next episode. Thank you so much and have a wonderful day. Bye-bye.
Wow, what a journey. Thank you for joining us for the Voices of Nova Scotia Healthcare Heroes. We're so grateful to have you with us, sharing the incredible stories of those making a difference in our communities. From inspiring healthcare professionals to the everyday heroes, your support means the world to us. We hope these stories brought a smile to your face and a little more hope to your day. Remember, this is just the beginning. We've got so many more amazing stories to share, and we can't wait for you to hear them. So stay tuned and stay connected. Together, we'll continue to celebrate the people who make Nova Scotia such a wonderful place. Until next time, take care and keep spreading the love. See you soon.